Thank you for joining us for our community conversation series on COVID-19, sponsored by the City of Augusta and MaineGeneral Health. My name is Katie Doherty, and I am the President and CEO of the Kennebec Valley Chamber. These interactive and informational webinars are a chance for the businesses and the public to collaborate, listen, and inspire new ideas. The goal of each conversation is to learn from our local businesses and support our community during COVID-19. During this week's webinar, we will be discussing on creating a healthy community. Our panelists include Chuck Hayes, President and CEO of MaineGeneral Health, Dr. Steve Diaz, Chief Medical Officer of MaineGeneral Health, and Ingrid Stanchfield, the CEO of the Boys and Girls Club of Kennebec Valley. Thank you, panelists, for joining us today. I will stop sharing my screen so we can see you guys. So please feel free to submit questions. There will be a Q&A time at the end. What we'll be doing is asking everybody to give an update on COVID and the capacity of their industry, and then we'll move into some questions. So Chuck, I'd like to start with you. Could you give us an update on how COVID has impacted MaineGeneral and treating COVID cases and what protocols you are doing to help keep the Kennebec Valley and our community healthy?
Well, thank you, Katie, and thank you for having us today. COVID has certainly changed many of the ways that we interact with our community. There are many steps that MaineGeneral took to keep our community healthy. Early on in the pandemic, we initiated our Incident Command Center to manage the process. We shut down all non-critical services initially. We changed all of our intake processes to screen patients prior to accessing services. And then we shifted to telephone consults for patients who could have their healthcare managed over the phone. We set up tents for testing individuals and review and modified what we call our surge plan to take as many patients as we could if there was a surge in required inpatient capacity. We developed some internal testing capabilities and worked to secure additional personal protective equipment for the pandemic. We also set up additional hand sanitizer dispensing stations. We made sure that we had physical separation in our waiting areas, and we required all of our patients to mask in our organization. And once we had all of those protections in place, we started to slowly reopen our services. And now we're at the point where all of our services are currently open. During the process, MaineGeneral also provided guidance to businesses and colleges and the community about how they could safely reopen. And certainly the COVID-19 pandemic is changing here in Maine. Certainly we have had a fall spike in cases statewide, which we knew would happen as restrictions were lifted and there are more inside gatherings. Yesterday, the Maine CDC reported our third straight day of more than 50 cases with COVID-19. We have been very fortunate that our inpatient COVID census has been very low. And I think if the community continues to mask, wash our hands, and keep physically separated, we can really minimize the effect of this pandemic. Thank you.
Thank you, Chuck. Dr. Diaz, I'd like you to give us a little update and then also address the long-term effects of delaying care because of the fear of COVID.
Yeah, so as Chuck said, the COVID impact has created that we do things differently, and we've adjusted to that. But the bigger part of this pandemic is that underneath all of the COVID activity are people's health and their wellness. And putting off what you need to do today in your health and wellness realm is not a great idea. We have seen nationally that people presenting to the hospitals with more acute disease in a worse shape because they might have been having chest pain, and a year ago they had chest pain for an hour. They came to the ER and we sorted them to help them with what they needed. If it was a heart attack, that's time sensitive. We now have people waiting weeks at home with chest pain because they don't want to be seen, and by the time they get to us, the ability for us to intervene is much less. A lot of the gains in health and wellness have to do with ongoing primary care management of your high blood pressure, of your diabetes, of your depression. And we are able to keep people healthier and not have such acute diseases by having that touch in an ongoing fashion. So the COVID pandemic has impacted that pretty adversely, and that, again, people who aren't coming in, getting the standard care they need for their chronic medical diseases, and we need that to turn around. We've created safe office spaces. The whole nation has, right? Everybody's looked at their workflows, keep people safe, and we need to get back onto a platform rendering that chronic care. And the other big piece here, of course, is the parallel pandemic of the opiate addiction, or substance use disorder group. And again, that's a chronic disease. So delaying care for that, again, is giving us a spike in deaths in the opiate realm. And again, that is not going to turn around by ignoring it. So as Chuck said, we've changed our practices, the way we deliver care. We make sure that our employees and visitors and patients all screen in, and for employees, stay home if you're ill. It's a different world. We're also a resource for community partners. But at the end of the day, if you do have a chronic disease, the best thing you can do is get the routine care that you're used to and need to not get into trouble later on.
Thank you. So Ingrid, could you give us an update on the childcare world over protocols that daycares have to follow to keep each child and family safe, but also how you remain open for essential workers? Overall, how has the daycare activities changed for you?
Thank you for inviting me, Katie. I appreciate that. Back in March, all of our programs were fully operational: childcare, teen center, sports programs, community in our building, all of that kind of activities. So mid-March, when this was, the COVID virus was considered a pandemic at that point, we closed for 2 weeks because we had never dealt with anything like this, and we didn't know the severity of it or really what to do with it. So we closed for the 2 weeks, and I don't have all of the medical knowledge. So I thought, oh, well, within a month, this is going to just blow on by and we're going to be good. Well, that wasn't what happened, as we all know. So we closed the 2 weeks. We reopened with 35 kids in the beginning. And to put that in relationship, at the time, we had about 350 families using the club for childcare each day, each week. So to go from that down to 35, but most parents were working from home, or some had lost their jobs. So we just gradually, we started with the 35, we revamped the building. We moved everybody into spaces where there were hand washing sinks and restrooms, which have become much more important in our lives now than maybe we considered them prior to the pandemic. So over the period of time this week, we're in our 31 weeks of being open. Today, as I sit here, no active cases of COVID have been reported within our clientele. We're back up to 262 individual kids on our rolls. They're not all coming every day, but they're part of our programs right now. With childcare licensing and the CDC guidelines, we've changed the protocol in how you enter the building. Parents now come to the front door with a mask on, drop their child at a screening station, everyone's a temperature every morning. And then we have the whole list of COVID questions that we ask people to see if they've been exposed or been around anybody that has tested positive. So today that has been working for us. Also, less kids in the building, different entrances. We did allow the teen center to come back. They were not in operation from last March until when school opened. So they actually enter a different door to the building and go to their program space. So today, those are the things that we have in place. As all other businesses, staff that are sick, we're asking not to come to work. Parents to call us ahead of time if their kids are sick. We are trying to strike the balance between a teething toddler and a runny nose and COVID, because parents do need to work, and we don't want to be alarmist because we deal with those types of things all the time. So, we're trying to keep the balance with fever and all of that, that anybody with a fever is not in our facility. So each day is an adventure. You kind of never know, like this week, what you're going to be up against from week to week. But we do rely a lot on CDC guidelines that are on their website, as well as childcare licensing.
Thank you, Ingrid. Yeah, I will agree. Every day is an adventure and sure is different. So we're going to move into some questions that have been submitted. And some, feel free if you have something to say, let me know. But some are directed to certain people as well. So the first question I would say is more directed to Dr. Diaz. How can people, determine the difference between the common flu or COVID going into the season?
So I'm assuming they mean, how do you determine that without a test?
Mm-hmm.
The overlap between the two diseases is significant. You can't tell over the phone or by going to a website how to differentiate whether you have a severe case of the common cold, influenza, or COVID-19. It just is not possible. The problem is that, especially, most children who are healthy will have very mild symptoms, as all the diseases actually have asymptomatic carriers, people who might have the diseases but not manifest a lot of symptoms. And of course, some people get very ill with those diseases. So there's no way to tell just by telling somebody, well, I have a fever and a cough, I get this every year, I think it's just a cold. And that could be influenza, that could be COVID, that could be pneumonia or a cold, but it's very hard to tell. And it gets more difficult if you have chronic diseases. So if you have other things going on with your health, then again, it makes it even harder to say it's not something more significant. As you probably know, a little corollary to that question, testing has been a problem, nationwide for getting a COVID test. Influenza, testing is spinning up again, and that's not nearly as difficult. But that being said, the CDC guidelines have a lot of guidance on empiric treatment, that is staying home. If you're ill for whatever reason, limit your activities. After a week, if you're fever-free for 24 hours, you can then re-engage. And they did that because testing is an issue. So if you're able to stay home when you're sick, that's the best solution. If you have horrible symptoms like you can't breathe or crushing chest pain, of course, we'd want you to go to the emergency department to be sorted and attended to. But the original question of clinically, how do you tell the difference just by talking to somebody? You really can't.
So that sounds like it's going to be a very busy winter months coming for you guys.
Yes, a lot of the testing though for the COVID testing, a lot of the different companies putting out tests couple it with influenza. So they test you at the same time for each, so you can, they include other diseases as well, other pathogens. But really what we want to know is, do you have the flu, do you have COVID-19 or not?
That's good.
Okay, it'll be interesting because some of the preventive measures for COVID-19 also reduce the spread of the flu. So at least, and Dr. Diaz can talk better about this than I can, but in other parts of the country where they've been masking and doing things like that, the flu has actually been less than it has been in the past.
That's a really good point. So another question is, what does a procedure look like for you at your facility when you get a case? So MaineGeneral, if somebody comes in, whether they're at the door and they're visiting and they have those screening questions and you narrow it down that they have COVID, what does the next steps happen?
So maybe the scenario might be better. So if let's say someone comes to the emergency department because they have a cough and a fever, and we are in our protective gear, and we put a mask on them if they can tolerate it, and we do the test to see whether or not they have COVID. During the time where we're trying to evaluate whether or not they have it, we keep the mask on them, we keep the number of people going in and out of that room limited, and all of our team has the appropriate personal equipment, protective equipment on, no matter what their role is. If the test is negative and also they don't have the flu and we deem that they're not really that infectious, we might dial it back to procedural mask for ourselves. If they do have COVID, then we have to determine whether or not they need to come into the hospital or not, depending on their symptoms and how they're managing. And then we also work with the state to do what's called contact tracing. You try to say who's their immediate circle of family and friends who they've been in contact with more than 15 minutes over a 24-hour period. Are they symptomatic or not? Do they all need to be tested? Can they go to symptom-based screening? So there's a big program around going upstream to figure out where this might have come from and whether we need to do more testing or quarantine individuals to keep the community safe.
So Ingrid, I'd like to ask you that too. So what happens if the daycare gets a case?
If we were, if someone in the daycare was COVID-19, first we ask for a copy of that from their doctor so that we have documentation that they are positive. Then we would close the facility, the full facility, because in the situation we're in, people do have to walk through the main corridor to get to all of the rooms. So we would close for 24 hours with all staff and kids away from the building. The third day after the 24 hours, we would go back and clean the facility with the cleaning solutions that we've been guided to by the CDC. And on the fourth day, anyone who was not in close proximity to the individual who tested positive would be allowed back to the club. Say if it's the preschool room and that's where the case was, then we would ask all of those children who had been in contact with the child, maybe that, we'll pretend it was a child that tested positive, to go into quarantine for 14 days. So that's the way we're dealing with it right now. We haven't had we haven't had any positive cases, so we haven't had to do this, but that would be the protocol we would follow.
Thank you. Another question is for MaineGeneral. How many cases have you guys seen at your hospital of people getting hospitalized? And is there a shortage of the ventilators or anything like that we always hear on the news?
Chuck, do you have the number at the top of your head of number of cases we've had?
Yeah, from an inpatient perspective, I don't, but it's in the probably upper 20s.
And the follow-up on that is that the cases we've had, we've been able to manage quite well. Initially, when we suppressed our volume back in March and April, where everybody shut down, obviously we had some cases then and learned how to manage this very well and what the flow looks like and what the teams do. Early on, we had some concerns about our personal protective equipment supply chain that has greatly improved. We, like everybody else, did a full ventilator assessment of what did you have in order to help people who are really ill. And again, we've done well with that and have contingency plans. I think the most significant thing about COVID treatment and testing to highlight is that the testing is still evolving. There isn't rapid great tests yet. Some of the rapid tests aren't applicable to healthcare, and some of the community-based testing strategies from those also might have some problems. So we're trying to work that out as a nation, actually. So that hamstrings a bit to have a test that you can get rapidly that's very accurate in order to make decisions. And the other part would be the treatment part. The best treatment we found for COVID patients thus far really has been doing excellent basic care, that there isn't a magic medication that makes all of this get better. You've seen in the news medications that are touted as being the treatment, and none of them thus far have panned out. And it's good to try them. It's good to research this to get it right. But at the end of the day, excellent care at the right level, whether it's at home or in the hospital, is what's making an impact on helping people recover from this.
Katie, I'd say from our perspective, I think we saw our peak back in April where we had 6 inpatients, and since then it's been 1 or 2 or 0. So it really has kind of leveled out right now. Now we expect that given the lifting of some restrictions and the fact that people will be congregating inside more, that we'll probably see an uptick of that. But we have a specific wing where we isolate any COVID-19 positive patient or suspected COVID-19 positive until the test results come through. So we have a really good process in place to make sure that not only our community members stay safe, but our staff does too.
It's great. I would say I follow you guys on Facebook, and it was kind of cool, April, May, when you guys were releasing your COVID patients of, successfully, overcoming it. And that was kind of cool to see, and all your patients in the community coming together to cheer everyone on. It looks like we lost Ingrid, but I'm sure she'll pop back on. So another question is, with the holiday seasons coming up, winter months, Dr. Shaw has mentioned and Governor Mills has mentioned, limit the parties. But one of the questions is, should people still plan to have get-togethers for Thanksgiving and the holidays? What are your thoughts on that, Dr. Diaz?
I would say no. The problem isn't so much, we all know, so actually, if you take a step back, one of the things that's really impacting us is the lack of socialization, difficulty in getting out and, getting exercise in a safe manner. And normalcy is not what it was a year ago. And so whatever today is should be your new normal. Having said that, we still strive for the socialization and doing other things with other people. But right now is not the time to expand your cohort, your family, because the people you're putting at risk would be your older relatives, your mom, your dad, if they're elderly, aunts, uncles. So not to be a Scrooge, but right now, especially with the national and the uptick in cases of COVID, and we know that's going to come here. It's already starting to happen in Maine a bit, not as bad as other places, but this is not the time to relax the rules on social distancing. And everybody's heard the Maine joke, right? When they said you need to stay 6 feet away from each other, and the Mainers' response was, "Why so close?" It's very true today. Keep your distance, wash your hands, mask. We're not yet in a place where we can relax those strategies.
So the holidays will look a little bit different this year, but that's okay.
Yes.
It's better to keep your family safe.
It really is.
So another question is, what are one or two things the community can improve or continue to do to keep our community safe? Anything else besides the basics of washing your hands and wearing a mask?
One of the things they've seen internationally is the bar scene, or the socialization in restaurants, and that after a drink, people's inhibitions seem to be a little looser, and the tenets of distancing, masking, not touching, seem to diminish. And that's where we've seen quite a few outbreaks, is in those social gatherings. So really the best thing you can do is really the basic ideas of hand hygiene, masking, keeping distance. But the other part that's really important right now, and it has to do with the whole idea of socialization and being able to exercise and get out and do what you need to do, is that people are very anxious and stressed right now. It's been a few months since we've been into it. This is a marathon, not a sprint. And I think one other thing that I've been trying to impart is, if this is the best time to practice your patience. Everyone's feeling stressed. Everyone's a little bit on edge. Parents are out of sorts if they have kids, because the kids' schedule in school, maybe homeschool, partial, whatever. Everything is sort of on end. So as well as the mitigation strategies, it's really also a time to be more patient with each other and to really support each other, because specifically during pandemics or times of intense change in the world, post World War I or II, we always see an increase in behavioral health issues, and we're starting to see that. So being patient isn't the panacea, of course, but just understanding that we're all in this together, and as we continue our social distancing and other mitigation strategies, really try to focus on being in a good place. It's going to sound kind of corny, but being grateful for what you have, practicing gratitude actually goes a long way in helping communities as a whole and deal with issues such as large as this one. So there's nothing new about the strategy you need to employ. You just need to be cognizant that you're not in this alone and that everybody's in the same boat. So try to be patient.
Another question that came in, which is kind of addressing what you just mentioned, the mental wellness, Ingrid, have you seen that concern with that outlet for children not to be able to socialize, not be able to run around in the gym together? How has that impacted your atmosphere?
I think overall our kids have done pretty well, considering that they only were away from their normal schedule for that 2 weeks, and they've been with us the rest of the time, away from television, away from, all of the media that can also create anxiety for kids. This summer we played outside a lot, so that helped. So they're outside in the fresh air and, taking walks and doing things like that. Now that school started, that has created a whole nother layer of stress and anxiety for a lot of kids. Maybe kids that were struggling to start with in school, and now it's all based on the computer. Maybe they don't read well, so they're not keeping up with the peers in the room. So we're trying to just, as you said, Dr. Diaz, being patient and practicing patience with them, and that, if you did the best you could do today, that's good enough. Time for lunch and we're going to go out and play. Take a little break from this. So we're trying to work through the whole remote learning with our kids at the club, so that the 2 days are at school and 3 days they're doing remote learning with us. So we're trying to work and get the schoolwork done, but also be patient and tolerant of their abilities, and they do need to get out and play and run around and that kind of thing.
So we did have a comment just put in the chat that says Kennebec Land Trust will soon be publishing the second edition of our hiking guide, Take a Hike. So they said, this, I would say this is for you, Ingrid, they would love to offer small groups of hikes for the Boys and Girls Club, but also for the community. So keep that in mind if people are looking for some outside outlets to get some fresh air and social distance.
Right.
Any tips, Dr. Diaz, for that you would say for that mental wellness and that overall health right now?
So in medicine, in the last decade or so, the idea of feeling disconnected to your work, I hate using the word burnout, but building resilience has taught me one thing, and that is that everyone's different. And what I mean by that is there's no magic wand. There's no one thing that everybody will benefit from. But one thing I've been trying to impart on wellness and how to maybe garner more is that as human beings, we're used to moving. We feel better when we move. That's why exercise does great things for us, not just physiologically, but just in our mind. So whether it's yoga, walking, just even slow walking, just getting out, try something new. I guess the other part that I've been my grandfather had Alzheimer's, and so my dad, this is years ago, said to me, what can I do to prevent me from getting that? And one of the things that it also applies to wellness is in that conversation, do something you haven't done before. So this now might be a good chance, learn a new language, learn an instrument, do something that takes you, that you have to concentrate on, so you get it, your mind takes a break from whatever is weighing on you, especially now. So when I think of how you help people with this, it's movement, so walking, swimming, yoga, whatever you think you might like or have done and continue that. The other part then is doing something that's not related to what you've always done, that might just give your brain a different way to work and get languages, music, that kind of thing. It's very important that you do this deliberately, not just, I'll pick up a Duolingo app and do one app every 3 weeks. That's not going to do it. It should be, whatever you do, you should try to spend time on it every day. So it becomes part of you. And again, it gives you a chance to have an outlet.
I would say, Katie, just to add to that, I think, take some time to disconnect from the press at some point. The constant barrage, you need to, obviously you want to stay informed, but you also need to give, yourself a rest from all of that. And doing a lot of what Dr. Diaz said will help with that.
Yeah, a digital break too. Get off social media,
Yes.
the news, Zoom meetings. I mean, they're great because we get to connect, but maybe you have one day where you don't schedule any Zoom meetings and you can just decompress. Yeah, I think I'm getting zoomed out, but I think we all are, but it's still great because we get to connect. Another question is, with so many of our local schools, with so many cases now in our local school, this worries me with my employees. Anything extra I should be doing to keep my business safe, or just let them work from home, or any transition or suggestions to get people back to work safely?
As I said before, there's nothing magic in any of the things we've said. But one thing I will say about that is that I'm gonna pick on masking a bit. The masking does work. Countries who do masking more ubiquitously have better outcomes on suppressing the COVID activity. Now, a 2-layer mask, as mentioned by the CDC, or face covering, I'm not sure what it does really. If I talk loud, I can talk through that mask, and the mask doesn't prevent me from inhaling anything. It prevents me from perhaps expelling. What they all do together though, but the masking, hand hygiene, distancing, staying home if you're sick, as a complete process, that is the goal. And so my answer to that would be, you can't relax any one of them. You can't say, well, I'm doing 3 out of 4, so I'm doing okay. That's not going to work here. I think that my answer to this is, the best way for the community to reopen, be safe, is that wherever you are, you're doing the masking, hand hygiene, social distancing, and staying home with your sick. You have to do all of those to be successful. You just can't pick one or the other. I know that's very hard. I know it's become somewhat of a political statement. I'm not saying this politically. I'm just saying, from what we've seen on the communities that have done well, they've done all of those consistently. And so we should do the same.
And
So
I think,
go ahead, Chuck.
I was just going to add, I think part of the problem we have too is culturally, we have this belief that, if you don't go to work sick, then you're a wimp, or, you don't really care about your job, or you're not dedicated to what you do. And this is the time to stay home. This is the time. If you run a business, I think you really got to impart on your employees that if you're not feeling well, stay home, get checked out, get cleared before you come back to work. Don't tough it out. Don't bring it to work. I think that's if you can drive that message home along with what the other piece that Dr. Diaz said, I think that is so critical.
So would you say, as long as people are doing social distancing, masking, hand sanitizing, washing hands, it's safe for them to be at work? Or would you still recommend that if people can work from home, to still do that?
There's one more complexity for the work piece. That's good that you brought that back up. And that's the air handling system. That is, in a room, in a small room, if you're working in cubicles next to somebody and there's 20 of you in a small area, that's probably not ideal, right? Because it's gonna be hard to have 6 feet. So the work piece is a balance of being able to implement those strategies while you're working, have this distance and have air circulation, windows open. Although in Maine, January, windows open is kind of hard. Or else rotating work from home or something. But yes, one of the reasons it's harder for the flu season, or we get the flu season spike and now a COVID spike that'll come up in the cold weather, is that we sequester inside. So that'll make things difficult. So if you're able to have it so that your employees can space appropriately and you have good air handling, great. If you struggle with that, you might need a strategy to rotate employees through so that you're able to adapt to that, the new reality.
So is the air handling, is that a test that somebody could call the local company to come in and get that tested, or how does that work?
I'm going to punt to the engineer on the call.
Chuck?
Yes, so there are different companies that can basically look at your air handling system, make sure that you could add HEPA filters, depending on the flow, but also in some cases increase the airflow with your existing system. So any HVAC company can come and do that evaluation and look at your air exchanges and what you may be able to do to improve your system.
Perfect.
I really want Dr. Diaz to answer that question. You probably could answer it, just so it's not bad for me.
Ingrid, I would say this question is more directed to you. If schools continue to go remote, what are concerns with daycare availability? If my staff, still have to work, or, I'm an essential worker, it's pretty well known that there's a daycare shortage, in Kennebec Valley. So if schools do have to go remote, do you guys have openings, or what is the consensus around the community for that?
Right now, if schools go red, which I'm just getting a text message
Oh,
from
no.
people at my club saying, be prepared. This is the situation we're in with our child care center, and we are one of the bigger centers around. We're at capacity right now. We have 52 little clubbers from 3 weeks to age 5, and we've limited school age to 75 children from kindergarten to grade 5, with the understanding that any day of the week, they may all have to be with us. We never had to function like that before because they were only with us before school and after school, and maybe a workshop day or whatnot. But now they're potentially with us 55 hours a week. So we can't have the same registration process that we did before, because then it creates more exposure. And we have to be true and faithful to the people who are registered and part of the club right now, that if any day of the week they all have to be with us, that we can do that. So right now for the community, really we're at a max, unless somebody, gives up their space or something like that. But I do feel for the parents that, call on a regular basis, and we don't have anything. And there isn't anything out there. Several have closed in Kennebec Valley, several child cares. So it's a big issue.
So for MaineGeneral side, a lot of your employees are essential workers. So what happens, I'm sure it's flexibility and stuff like that, but any other guidance for any other employees that, might be essential workers on what to do if they need to be home with their kids?
Yeah, so one of the things that we've implemented is really some flexibility in scheduling, and certainly have asked our managers that if they can, work around some of the challenges of, the staff having to be home with the children and last minute changes, if they want to work different hours, different times, if the job can do that. The challenge that we have is the patient-facing folks, so we certainly can't change their hours, but we look to help with filling in per diem staff to really backfill those that, get pulled away. But I will tell you, it's a big challenge because like most, and we're fortunate that we have folks like Ingrid that help a lot of our staff out at the Boys and Girls Club and other places, but there's really no warning, and it's the next day, and so there's not a lot of time to plan. So it certainly is a challenge throughout, but so far we've been managing it fairly well.
So another question that came is what are the plans for rolling out the vaccine when it is available?
So the COVID vaccination planning, kudos to the state of Maine. They've been meeting on this since August, I believe, weekly, trying to get ahead of what this might look like. The National Academy of Sciences that oversees medicine has put out its plan. I would not recommend reading it unless you have insomnia. Then go ahead and read it, and it'll get you right to sleep. But it lays out the tiers and the phases of who would go first in getting vaccinated. The first tier is healthcare workers, so that you have essential workers to provide the health. It then delves down into long-term care participants or other high-risk groups, and goes from there. It'll be interesting. I know the vaccination trials are ongoing, and as you've seen in the mass media, 3 have stopped for periods of time because of secondary effects of the vaccines. One thing I just want to highlight for everybody is that vaccine development traditionally takes about 10 years. And of course, this is 2020. Why does it still need to take 10 years? And it's not that they can't find a way to create a vaccine that might work. That's not the issue in vaccine creation. The problem in vaccine creation is trying to make a vaccine that is first efficacious, so it mounts the immune response you want, so testing for that, then making sure the side effects are appropriate. Vaccines do trigger an immune response, so you want to make sure the immune response it triggers isn't one that causes more harm than good. And that's why vaccine trials typically take 10 years, is it takes a cycle, it might take 3, 4, 5 cycles, and each cycle is about a year, to figure out how you're doing with that. So I do believe it'll come out sooner than 10 years. I think, you know, today's day and age, they'll find ways of mitigating some of that. But I also think that my point of making that point is that when it comes out, they're going to want to target a group initially where they can really monitor it quite closely, since they are fast tracking a process that typically has many levels of safety built into it, because you wouldn't want to completely do away with that in the new world. So it'll be very interesting. It's a different process that they're using. As you know, the FDA is trying to figure out exactly how this could be as safe as it's been in the past, and I'm sure they'll get there. So I do expect something probably in the new year, but I do think it'll be limited given everything I just said.
I just say, Katie, the federal government will be controlling the distribution of that vaccine and controlling who gets it and who's allowed to have it, you know, as outlined by what Dr. Diaz just said.
So another question is testing. So they say they see a lot of the white tents outside of Maine General. And is that something, so if I feel like I have symptoms, should I call ahead? Should I just pull up to the tent? Can you talk a little bit about that?
Yeah, so we prefer you to call ahead just so we're aware that you're there. But if you show up, we'll also take care of you. The testing we do primarily is for people who have symptoms. Those are the tests that are, you know, as you know, sanctioned by the state of Maine primarily. We also do have an asymptomatic testing site, you know, spun up by the state of Maine with us in our workplace health, which is our occupational medicine arm. Testing is better than it was 5 months ago, but it's still not really where it needs to be. You probably read in the news about all these tests being distributed. Akin to the vaccination discussion, testing also needs to be verified. A lot of the tests that have small sample sizes don't have the accuracy that allow us to have confidence in the result all the time. And that's not a great way to tell somebody you either have or don't have the disease. So testing is still very much evolving, but to your operational question, yes, the white tents are typically at our express care sites, and we are prepared to do testing there.
Let's see. Another question is, are visitors allowed in the hospital right now?
So, well, right now, yes, we allow one visitor per patient. So they check in at the front desk. They're screened just like all the patients are screened before they come in, given a mask if they don't have a mask, answer the COVID questions. So we are allowing limited visitors. Now, quite frankly, if the incidence pops up in the Kennebec Valley, we may go back to no visitors again. We monitor that on a daily basis, and we make adjustments to our operation based on how much spread there is in our community.
Ingrid, a question for you is, daycare workers, I guess this is kind of hard. You can't really control what they do when they're not at work, you know, or on the weekends, or who they're intermingling with. Do you test daycare workers or staff on a regular basis?
We don't test daycare workers or staff. We are living with the questions that we've been given for COVID and don't come to work if you're sick. So really we're trusting people's word when they, you know, come and check in and answer the questions. We do the temperature screening. To date, most people have been really good. Like if they don't feel good or they, you know, they've got a cough or a runny nose or whatever, they stay home. So no, we haven't implemented staff testing.
Maine General, are you guys staff testing at all, or just if symptoms?
Just if symptoms.
Perfect. So I think I have gone through all the questions that have been submitted. So again, I'll put it out there. If anybody has questions, please submit them. We've had some great ones come in. This has been a great conversation. What we'll do is we have about 15 minutes left. We can do a quick roundtable of, you know, any closing remarks or any suggestions for the community of, you know, thinking in mind of the holiday season and, you know, anything like that. Or I don't know if we want to just go around the table. We'll start with Dr. Diaz. Any closing remarks from you?
Oh boy, I got to go first.
Pressure.
So I want to echo what I said earlier about the toll it's taken on people and their well-being and health. And again, please don't put off healthcare. If you have a chronic disease, we want to see you. We want to talk to you. It's very important. We really have seen quite an uptick in more advanced disease states because people are suppressing or electing to stay home when really it's important to get that ongoing care. And the second part, really the closing part, is your wellness and well-being. And please don't take it lightly. Find something that you can do every day that makes you happy, that makes it so you are able to be more patient. My wife and I, we have 5 children, 4 are still in the house with all different schedules for school. So I know what I'm talking about stress. So please take care of yourselves so you can take care of your families and each other, and do not take that lightly. It's an important time to practice self-care.
Chuck?
I didn't have to go after Steve. I mean, that was great. I would just say, I think it's really up to us as a community to control this thing, and quite frankly, we know what to do, and I think we just need to do it. I think unfortunately, regardless of your political beliefs, it's been politicized, and really what we should be looking at is the scientists and who are leading the way and telling us really what we can do to protect us and our loved ones. So again, before or after or any time, the Maine General can be a resource to answer any questions of the health. We've worked with a lot of people, businesses, and schools and things to help them do the best they can. It's not perfect, and we're learning. And like Steve said, in 2 or 3 years, we're going to be really good at this. But right now, with what we know that the basics can really help us. So, and certainly reach out if we can do anything to help the community.
Ingrid, any closing remarks from you?
I just like, when we talked to the kids about wearing masks at the club, we reiterated with them that this is about patience and practice, that we're all being patient and learning as we go and accepting each other as we go along. And I think that's important, especially for kids of all ages, that this pandemic and COVID-19 is nothing that any of us requested. And if I have been affected by it or my family has been affected by it, I need to be treated with dignity and respect. So that's what we're trying to instill in the kids, and hopefully dispel the fear that they have of this big germ monster that, is going to get them from wherever. So really to just practice good patience and taking care of our kids and reassuring them that, we're going to do the things we need to do and keep going each day.
Thank you. We did have one more question that came in. What is the testing policy for traveling to out-of-state safe areas? Does insurance cover prior to travel and return test? How does that work? So if they did travel out of state, they come back, they kind of need a test to make sure they're safe, but they're not showing symptoms or.
So different insurances handle that question differently, just to put it out there. But the state has contracted with, I think, most of the health systems in Maine to stand up what they call swab and send sites for people who are asymptomatic. And so for Maine General, that's our workplace health location in Augusta. So that is the place you can get a test to ascertain post-travel whether or not you have COVID or not.
So you call them and make an appointment, and then drive up and they'll take care of it.
And how long normally does it take for results?
It varies. So that testing goes to the state lab. There's many testing scenarios in the state of Maine. But the state lab is the one running those tests. The turnaround's anywhere from 3 to 5 days at this point.
Perfect. Well, thank you again to our panelists. Thank you everyone for joining us today. Thank you to our sponsors, the City of Augusta and MaineGeneral Health, for bringing these community conversations to all of you. I would like to say that the Chamber does have PPE for anybody free. So give us a call. We have face shields and masks and hand sanitizer. So we know it's a huge expense for our businesses to it adds up after a while. So, give us a call. We do have free PPE for you guys. So thank you again for everybody for joining us. If you would like to attend another Zoom meeting later today, we do have a virtual after hours at 4 o'clock, and we will be joined by Travis Mills for a quick little chit chat and be entertained by him for a little bit. So join us later today at 4 o'clock if you would like. So thank you everybody for joining us, and thank you again to the panelists, and hope you all have a great day. Stay safe.
Thank you.
you.